NCDs, also known as non-communicable diseases, and COVID-19. So maybe as a starter, before we put COVID-19 into the mix, what are NCDs?
So thank you, first of all, for having me. It's really nice to be with you today. And non-communicable diseases is the 5 major diseases that unfortunately kill most people in the world. So it is the heart diseases, the cardiovascular diseases, it is diabetes, cancer, and lung diseases, plus mental health disorders. So, many people don't understand the abbreviation NCD because but all people know people that either lives with non-communicable diseases or unfortunately they have one themselves. So it's the most usual diseases. So approximately 41 million people die every year from these diseases. And unfortunately, during COVID, they have been very much impacted, as we will discuss, I'm sure, in this Facebook Live.
Yes, thank you. Now for the watchers around the world, just as a reminder, I think some of you already know, if you want to leave a comment or ask a question to our expert, you can do so in the comments question. And if you are watching us on Twitter, feel free to send out a tweet adding the hashtag AskWHO, and we will try to get that question answered. Now, Bente, in your introduction, you mentioned some of the NCDs. Could you maybe say which ones have the most impact globally?
So all of them have a huge impact, but the cardiovascular diseases, the heart diseases, is really the one that is killing most people. So approximately 18 million people are dying from cardiovascular heart diseases every year. And the second one is cancer. So 9 million people, respiratory diseases, meaning lung diseases, 4 million, and diabetes, 2 million people. So this is, and other NCDs then altogether 11 million. So that is sort of the order. But I think we can just say at this point in time that, these are all the most common diseases. And the good thing is that they can be prevented, as we will probably come back to.
Yeah, thank you so much. And is it true that NCDs also have a correlation or an impact on the outcome of COVID-19? Can you tell us more about that?
Mm-hmm. So I think today, as we are speaking, we have millions of people really impacted by COVID-19 in all different ways. I mean, we know many people have lost their near and dear ones, and healthcare workers are really struggling hard to support patients and families. So we are in a very, very challenging and serious situation. So of course, our first and foremost task today is to defeat the COVID-19 pandemic. But the COVID-19 pandemic has really revealed, it has been like an X-ray, you could say. So we can see that people living with NCD are actually the one dying the most and also getting severely ill from COVID-19. So that's sort of number one. So if you have an NCD, you are more at risk. And we can see from all the countries that the people dying at hospital, they usually also have an NCD. But the other one is also because governments has been forced, I would say, to change the way they run their healthcare system during the pandemic. Also, the people with chronic diseases and especially the NCDs has been impacted by lack of access to hospitals. So we have seen in some countries that, the number of people that has been seeking help for heart attacks even has dropped with 25% during COVID. And this is, of course, very serious and to a huge concern for many people.
Yeah, thank you. And you mentioned that people who have underlying health conditions, such as NCDs, are more likely to be impacted by COVID-19 outcomes negatively. What can these people do? So people who have NCDs, what can they do to protect themselves from COVID-19?
I mean, first of all, they should try, as everybody, to live healthy, because we have so far talked about the diseases, but it is well known that if you quit tobacco, if you reduce or stop drinking alcohol, if you eat healthy, and if you are physically active, we will, under normal conditions, be able to reduce the people that get NCD, but also the outcome of NCD. So, of course, during the pandemic, it's exactly the same and even more important. So, and I know it's difficult because many people are staying at home. They have sort of difficulties maybe to get to the stores. The stores can be closed and so on. But I think the most important is that they really try to do this, quit tobacco. And unfortunately, we have seen, a huge interest now in quitting tobacco. When we launched our artificial intelligence first staff in WHO, no, Florence, we have seen that millions of people really try to get advice to stop and quit tobacco. So it's even more important that you quit tobacco, that you reduce the amount of alcohol consumption, or even better, have no alcohol during this challenging time. And of course, try to eat as healthy as you can, and also stay active at home or in the conditions you live in. So that's sort of the general advice. But of course, in addition, it's also very important that the people already having heart diseases, respiratory diseases, lung diseases, and so on, that they really take care of their health. And we have seen that in many countries, when they had to sort of close down and partly or fully close down the health institutions for chronic patients, they have been able to shift, for example, to more telemedicine. So I think a very strong advice is that you, as a patient, you have to utilize whatever the government, the community, the municipality offer you. And if you can't, you should continue to go to the hospital. You should seek advice. If you have pain in your chest, of course, you have to go to the hospital. Don't be afraid of COVID. In these instances, it's very, very important to seek help. And if you can sort of self-manage, and we can see that in many countries now during COVID, self-management plans has been put in place, and people, like, family has been trained to support the patients even more. And also, very importantly, of course, secure the medication. Try to get your doctor to help you, to support you with medication, not only for a week or 2 weeks, but really for the longest possible period of time. So you're not sort of, you don't need to go outside to get your very important medication.
Okay, thank you. And for those who just joined us, we are talking about NCDs, also known as non-communicable diseases, and COVID-19. If you want to ask questions, please do so in the comment section, or if you're on Twitter, use the hashtag AskWHO. Now, Bente, you just mentioned that if we adapt the right lifestyle changes, we can maybe prevent receiving NCDs. Could you repeat what are the things that people should consider doing? For instance, you mentioned not smoking, avoiding alcohol. What else is there that they can do?
So, it is not very difficult, but because it's 4 things to remember. First of all, it's to quit tobacco. That's the first thing. I mean, tobacco is a completely unnecessary thing in your life. So maybe this is a good thing. Use the confinement to really improve your health and quit tobacco. This is important. And there are online resources, like, as I mentioned, we even have artificial intelligence support. Florence, you will find her online. but there are always ways to get support to quit tobacco. That's the most important thing you can do. Then, of course, the second one is to limit the amount of alcohol consumption, or maybe even better, don't drink at all. As you know, when we are in a situation like this, we are also at risk to get mentally sort of impacted. I mean, you can get depressed. We find life more difficult than before. And since alcohol is a psychoactive substance, we know that this is really not healthy at all to use alcohol when you are at risk in the first place. So that's the second one. The third one is to eat healthy. And sometimes that can be difficult in a situation like this, but I think it is usually, at least you can choose less sugar. Hopefully you live in a country where the food is without trans fat. And there are lots of advices online, lots of resources that can help you. And I would say many creative solutions as well. And the last one is super easy. Even in whatever shape you are, you can be physically active. And this is important. So at least 30 minutes a day that you are physically active. All of these 4 things will help you both during COVID, but actually these are the main advices for an individual also during all times. And that's why we are hopeful, even if we are talking about very, very serious diseases that kills 41 million people a year. We know that we can prevent people from dying too young, meaning dying before 70 years of age. If they do these 4 things and really reduce the risk factors for the non-communicable diseases. And that's what all of us are trying to do. That's what WHO try to support countries to do. And that is also what the governments has promised to support their populations to do. So these 4 risk factors are very, very important to focus on.
Yeah. So it's important to make the right lifestyle choices and think about your health. No tobacco, no alcohol, exercise, and healthy food. For those who joined us, we're talking about NCDs and COVID-19. You can ask questions in the comments section, or if you're on Twitter, use the hashtag AskWHO. Now, Bente, I know you mentioned this at the beginning, but we have a couple of questions on social media regarding the NCDs which have the highest impact globally. Could you please repeat maybe the top 3 or 4 on the planet? Thank you.
Yeah. So the most sort of impactful in a negative way, the NCD that most people die from is cardiovascular diseases, meaning heart diseases. So 18 million die every year from heart diseases. And then you have respiratory diseases and diabetes and cancer. So cancer is the second most frequent, I would say, of the non-communicable diseases. So these are the 4 sort of diseases. And then you have a very big amount of mental disorders that are also part of the non-communicable diseases. And I didn't mention that, I think, but there are some myths about non-communicable diseases. Some people think that, okay, this is only the diseases for the wealthy people. This is sort of a part of having more money, having a car, having the money to have more food. Unfortunately, this is not the case. 2/3 of all of those people, people that die from non-communicable diseases before 70 years of age, meaning dying too young, is actually living in developing countries. And so, developing countries, they have all kind of burdens. They are really at very, very high risk. And when we have a situation like the COVID, where countries that are in development usually have much less developed health systems, then again, people are even at more risk. So even more important to full on the prevention side, but also, of course, that we need to, after COVID, really learn to build back even better. We need to do it even more even more forceful and try to really support all these people that are at risk.
Yes. And now that you mentioned it, we also have a question from Nira on LinkedIn, who's touching upon that subject about how NCDs are going to develop. And basically, she's asking, how do you see the impact of NCDs in the next decade, especially regarding disabilities?
Okay, I think I can. We just published some very important papers last week. So we had one paper that talked about more sort of what is the condition during COVID for people living with NCDs, what is their possibility to get their services and so on. So that's just now during COVID. But we also had another publication coming out with colleagues from Imperial College, from Lancet, and also from NCD Alliance. And this is showing that, we have to work much harder. So what we can see is that from 2000 until 2012, we actually had a very good decline in the number of people with NCD. So as many of you know, perhaps, is that all the heads of state and governments in the world, they have decided that they want to reduce the number of people dying before 70 years of age with 30% before 2030. So this is part of the Sustainable Development Goals. So as I said, in the first decade, we had a very nice sort of decline, not enough to reach the target, but at least it was sort of looking very good. Unfortunately, now we have seen in the last sort of decade that this is dwindling. So it's less sort of positive development. So we cannot see the same sort of development towards to reducing the non-communicable diseases. And this is very, very serious. We even see that for the people with diabetes, we have an increased mortality with 5%. So that means that we need to really address this even more. So I think we can utilize the experience that we see now during COVID, which has been like an X-ray on health system, that we need to change the way we work. We have to continue to be very, very clear on the prevention side. And so far we have talked about the individual things that you can do on prevention. We can talk about what governments need to do as well, but we need to really utilize the best buys, the way we can change and reduce the risk factors that leads to NCD. But we also need to learn from the COVID that we have to strengthen the health system in a different way. So also the people living with NCD can get their services as part of essential health services and universal health coverage. So this is very important. So I would say that we are at a very critical juncture. If we are not scaling up our efforts to curb NCD, we will not reach the target that we actually have decided to reach during the Sustainable Development Goals in 2030.
Yeah, thank you for that. This actually goes hand in hand with a question on LinkedIn from Chandra, who's asking, what is the plan of WHO for NCDs after the COVID-19 pandemic? Can you give us some insights there?
Yes, so we are now working with countries at all levels. So we meet every week actually within WHO, where we meet with people from all the regions of WHO, telling us how each of the countries are developing. So the first thing we need to do is to include NCD into the preparedness and response plans. During a pandemic like this, every country has developed a national response and a strategic plan. And we have seen too little reflection on the non-communicable and chronic diseases so far. So the first thing countries need to do is really to look into their response plans to see that also chronic diseases is sort of in the plan when they have a response to a pandemic like that. So that's sort of urgent. So I think we need to understand more that, chronic diseases is very, very important also to focus on during a humanitarian crisis and during a pandemic. And this is not the first time we see that. We see that many times. We have seen it in refugee camps where more people have got their legs amputated because of lack of insulin than of landmines, for example. So that is very, very important. So that's sort of an acute measure. But of course, we need to learn from the pandemic, as I said. So, and there is also very nice learning points. We can see that more and more countries is mitigating the situation by using telemedicine, digital health. They are sort of what we call task shifting. So it's not only the doctors that are sort of taking care of medical things. We also have a shift towards nurses, towards other community workers. We have more focus on self-care, and we have other ways to ensure that people get their medication and so on. So this is really learning points from the pandemic that we will take into the sort of building back better. But then it's, of course, to build back better. And in the NCD area, we have the goals, we have targets. We have targets for tobacco, for alcohol, for how health systems can be strengthened, and so on. And we have goals, as I already mentioned. We know what we want to achieve. So it is the how, and we have to really focus on how are we going to scale up? How are we going to achieve these things? And I think that is something that is maybe needs some more considerations, and it needs more funding as well. So we have tried to summarize this, and one of the learning points is that we need to bring the people living with NCD also to the decision table. We saw this in the HIV/AIDS era, that people living with the diseases actually have a huge set of knowledge on how to implement, because we are talking about implementation. We know very much about what we can do, but we need sort of really to implement at scale. Then, of course, to be more clear on what is essential health services for NCD, and include NCD into what we call universal health coverage. That's also very, very important. And also to strengthen the primary healthcare level, the level which is the first level in the healthcare system that the patient usually seek advice and treatment from. That is also very much important. And of course, we have, I call it the best buy. It's a lot of jargon, but when WHO it works in close cooperation with countries. And we have, since 2013, developed a menu of policy options, which we call the best buy. And we know that if countries really implement these best buy, we will reach the goal. So we know that, for example, today, 5 million people live in countries where they have introduced smoking bans and graphic warnings and so on, which we know will help them to quit tobacco. And we also know that 3 million people are protected from harmful trans fat, as we discussed, healthy food. And we know that 3 million people now are covered by protocols to get treatment for their hypertension. So these are examples on how we can do that. So that is also very important. Then another thing that is important is, of course, money, because the health budget has to be strengthened. It is not that the cost of prevention of NCD is actually a cost. It is an investment, and the return is super high. But if we are so unfortunate that people really get heart, lung cancer, and diabetes diseases, we know that the cost for the healthcare system is very, very high. So the cost of not preventing is super high. So one of the things that is really among the best buys and also help people to quit tobacco, to reduce their alcohol consumption and eat healthy food is that we need to use what we call fiscal measures, namely to put taxes on these very unhealthy products. When we put taxes on, we will sort of help and support the population to not choose these products. And at the same time, we will get more money into the health system or into the budget and to the health budget for the countries. So these are very, very important measures.
Yeah, thank you. I know you mentioned this at the beginning, but what exactly is the impact of COVID-19 on NCDs? Because we've had a couple of questions now on social media of people who would like to know exactly what the impact is. Could you just summarize it quickly in a nutshell?
Yeah, so I can summarize in a nutshell, and I can also give a couple of examples, but let me summarize first. It's basically two things. First of all, we know that people who has heart diseases, cancer, lung diseases, or diabetes, they are at a huge risk to get more severely ill and die from COVID. So if they get COVID, they are more at risk to get severely ill and also to die. So an example of this is, for example, when we looked into the people dying in hospitals in Italy, we had as many as 67% of them living with hypertension and 31% were living with type 2 diabetes, just as an example. So that's the first thing. So they are more at risk. And the second, which is not as easy to spot immediately, but that is that when we tackle a pandemic, many of the health systems has to be shifted towards, for example, in this case, COVID-19. So the consequence of this is that there is less access for the people who has chronic diseases like the non-communicable diseases. So we have seen in a survey we did back in May, which 163 countries responded to, that 60% approximately of the services for hypertension treatment were disrupted either partially or totally. So one of the publications that WHO came out with last week showed the same, that one of the most disrupted services was for NCD and for mental health. And these are really the people who need these services because they need them almost every week, maybe every day, every month, and so on. And among them, of course, the cancer treatment was also disrupted in 55% of the cases. So more severely ill and risk of dying, and also that the health system is less accessible. I would like to add, because this is very, very serious, of course, but immediately when we realized this, and we realized this very quickly because the healthcare workers alerted their governments, that alerted WHO, and also the civil society was very early on telling, the world that this is happening, we need to do something. So we have, as WHO, developed guidance for governments and policymakers to help them to know how can they sort of reduce the effect as much as possible. But the big learning point is that we need to build back better in a different way to support people living with NCD for the future.
Mm-hmm. Thank you. For everybody who's just joined us now, we're talking about NCDs, also known as non-communicable diseases. So that can be diabetes, high blood pressure, asthma, heart disease, cancers, and so on, and COVID-19. If you have any questions for our expert, please comment in the comment section, or if you're on Twitter, you can use the hashtag AskWHO. Bente, you mentioned previously that individuals can do things to prevent NCDs, mostly through smart lifestyle changes, eating healthy, avoiding alcohol, don't smoke, and that governments can also do things to prevent the spread of NCDs, for example, through policy. But what can the private sector do to prevent NCDs?
So I think there is no difference. We have agreed with, I guess, all stakeholders. I think that everybody understands, So of course, what we want private sector to do is to support the same agenda. So, for example, when it comes to access to medicine, what we want to see is that we have different sort of pricing structures, so people in the developing countries can have more access to insulin, for example, or to other very important drugs. And I can see a tendency that we are sort of getting a little bit closer to this. And we also have seen during COVID that we have had companies donating insulin, for example, for a period of time. So, but there is a lot to do still, and the sort of out-of-pocket payments, sort of the patient's own payment for medicines is too high, and the accessibility is definitely too low for many of the diseases, and many things are not accessible all over the world, and so on. And of course, when you look at the food and beverage sector, one of the first thing, and actually this week, which is an NCD week for all of us, we will see that we will have good news when it comes to trans fat. So we see now that there is a more and more understanding that we need to ban trans fat in food. And of course, then the private sector has to apply and produce food without trans fat. And we can see that coming on. What is very important is that we have seen, unfortunately, undue influence from tobacco industry and from alcohol industry during COVID. And of course, we can imagine people are in a very different setting. They are really much more online. I guess, they are out of their natural routines and so on. And in a sense, they are much more at mental risk for sort of also adapting negative ways of living. So we have seen examples of this, and countries are more and more vigilant to protect their population against this, what we call undue influence, meaning that if we see tendencies that, suddenly there is more sort of positive mentioning about smoking or drinking in films or in advertisements or something like that, this is something we really have to be very, very careful, because we have to protect people against these kind of things. And then I want to mention something we didn't mention earlier in this Facebook Live, and that is also, I didn't speak about the fifth risk factor, because we have spoken very, very much about tobacco. We need to quit tobacco. We need to reduce or avoid alcohol. We need to have healthy food, and we need to be physically active. But the fifth risk factor is also very important, and that is air pollution, both outdoor and indoor air pollution. And we have actually seen how much that means to populations, because during COVID, during lockdown, of course, the traffic has also been stalled in many cities, and we have been able to measure the much lower air pollution level in some parts of the world. So, of course, that is also important, and also that is also coming back to private industry, of course, and private sector, because we also need to shift to less air polluting ways of both, driving cars and all that, but also the way we heat our houses and all of these things as well.
Okay, so a lot of people and organizations have to take responsibility for NCDs. And you just mentioned the risk factors. We have a question on LinkedIn from Nasser, who's asking, if you take the right lifestyle changes, are NCDs reversible?
So I think we cannot say totally reversible, but we can reduce, the people dying too young, meaning before 70 years of age. And we know that reducing risk factors can help us to achieve our goals with 50%, and then we need to also, improve our health system. So, but it's very, very important. We are sure that if we really implemented all the measures, both individual measures, but also the measures done by the government, we will be able to reach the target that we have set. So it's very important. But totally, we cannot get rid of all these 4 diseases, but we can manage them. We can reduce the amount of people suffering from them, and we can also, improve the well-being and life of these people, and they can live longer.
Yeah. Previously, you mentioned the NCD Action Week, which is going to take place from the 7th until the 13th of September. Would you like to tell us a bit more about the NCD Action Week?
So the NCD Action Week, we are very happy about this. It's organized by our very, very acknowledged partner, NCD Alliance. And it is something that we from WHO support very much. And it gives us an opportunity both to sort of highlight, the challenges, but also the solutions. So I am very happy that we are able every day now to give an example from countries, how they have started to work in a different way. We can learn from that, and it really give us a hope for the future. And we will also have, during the week, launches and events, both on how we can strengthen healthcare systems at primary healthcare level, and how WHO can support that with something we call PEM packages, which is really the way that healthcare workers and health systems, even at the most sort of least resourceful levels, can support the patients, and we can really give good management. And also we will have launches on healthy food and trans fat. So it would be very good to both have the response from the listeners here, and also, of course, there is a golden opportunity for all of you as well to use the event and post both your own experiences, your questions, your solutions online as well.
Okay. We have a question from Nirmal Darnal on Facebook, who's asking if WHO has any guidelines for countries which are mostly affected by NCDs and COVID-19.
So WHO has produced, I would say, a huge amount of very, very important both guidelines and guidance. And I will suggest to anybody online here, and I'm sure Walter can help us as well, to give a link to the webpage. It's actually a very easy, accessible webpage. And I think most questions you may have will be able to find an answer for. And even if there are no answers, you will also be able to see what is sort of in the making, in the doing, in production, so we can be supporting. But there are a lot of guidance. So it's guidance to policymakers. For example, as we discussed now, the change in access to people living with chronic diseases. There is a very important guidance supporting countries on what can you do to sort of reduce the harm and at the same time try to defeat COVID-19. So that is very important, and it's also guidance. When fortunately many countries are now out of the first sort of or out of the worst part of the pandemic, how can they restore and reinstall the health services? In what sort of way should they do that to really accommodate for the people also with chronic diseases? So it's these kind of guidance, but it's also very, very specific guidance. Stay healthy at home. What can you do? Tips and sort of I would say, examples. We have a very, I would say, beautiful suite of guidance on mental health conditions, on how to stay mental healthy during COVID. It is a beautiful publication for children. Sometimes we forget about the children, but the children is, the hope for the future, and also very, very important to take care of them, good care of them during COVID, and both on the mental health side, but also, of course, on the risk factor side. So it's a beautiful book on mental health. I think it was translated to more than 100 languages. Yeah. So you will find all these kind of things. And I think it's very important, because one of the problems during a pandemic like this is that it's such a sort of diversity of information out there, and especially on social media. And if I could give one advice, if you have any doubt, if you read something that you cannot understand, is this true or not, please go and seek advice on WHO websites, and also your, of course, government, your Ministry of Health, the government will very often have the best guidance for you, both as an individual, as a family, but also in the community or in the government.
Yeah. So you heard that there's a lot of information over on the WHO website. We'll try to share the links in the comment section. Maybe as a summary recap, we have one question on LinkedIn from Zinab, who's asking, what is the link between NCDs, or non-communicable diseases, and COVID-19?
So we have discussed this a little bit during the half hour, but I think it's absolutely worthwhile to repeat it. So it is basically two things. First of all, people living with living with the non-communicable diseases, meaning heart diseases, lung diseases, cancer, and diabetes. They are more at risk of becoming severely ill and also to die from COVID. So we have many publications coming from national level showing this unfortunate situation. This is number one. And the second is that also chronic patients, and especially people living with non-communicable diseases, has less access to the healthcare system and essential health services during COVID. And this is important information, and it is a call to action. And I said in the beginning that COVID has been as an X-ray, so it has sort of amplified and showed us the situation that was partly there before COVID as well. And this means that we need to build back better, so we in the future can have a healthcare system that is better sort of shaped to take care of the people with non-communicable diseases for the future.
Dr. Bente Mikkelsen, thank you so much for taking the time today to talk to us. That was our Facebook Live on NCDs and COVID-19. And I would like to say thank you very much for everybody who has been watching us from around the world, including Angola, the Solomon Islands, Mexico, England, Kenya, Vietnam, Nepal, Bangladesh, Malaysia, Indonesia, Germany, Poland, Greece, Canada, USA, Spain, and many more. Thank you for watching, and see you next time.
Thank you, Walter. Thank you. Thank you for having me.